National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Jonathan Beatty here, naturopathic doctor and a health expert at nationalnutrition.ca. Now, I enjoy sports as much as anybody else. The one thing I don't enjoy about them though are sports injuries. If you've ever had one, they can be very debilitating. They can actually cause a lot of chronic problems. And the biggest problem though is it takes you away from the sport or the activity that you love. So one of the things we want to do is, ensure that you're be able to get back out playing as fast as possible. Because although the old adage states, time heals all wounds, there are ways you can reduce the amount of time it takes to heal the wounds that you've developed. So things you want to differentiate. Do you have any type of ligament or tendon sprain or strain, or do you have an actual fracture? Best way to get this assessed, go to your doctor, go to your local ER, get an x-ray or some sort of imaging done so they can evaluate the extent of the injury. Many people often think, oh no, you know what, I just sort of sprained my ankle, I just twisted it a little bit. Not a big problem, not realizing that they may have actually caused a minor fracture, and by not having it assessed properly and treated properly, it can heal incorrectly, and that can actually cause long-term debilitation. It also goes for knee injuries. Many times people who tear ligaments in their knee, they can walk after. They might not be able to plant and move side to side, but walking frontwards and backwards works fine for them. So they may not realize the extent of their injury and just how bad it is. So that's why I always recommend do get assessed. Now, if your injury is more of what we call the soft tissue form, if it's ligament, muscular, or other, then what you want to be looking at is managing how that tissue is going to heal. Now, some of the things that happen, of course, with injury, especially in the acute stage, is you get your typical redness, pain, swelling, heat, all the signs that there's inflammation that is active. So to help reduce these, to allow your body to heal more effectively, you want to use anti-inflammatories. Now, from that, I'm not a huge fan of what we call the NSAID medications. These are the non-steroidal anti-inflammatory drugs. And the reason behind that is that although they will block pain, one of the things they can do is actually block the repair of collagen and connective tissue. So although they help manage the pain that's associated with the injury, they may actually impair the recovery of that injury. They may actually slow down your recovery. Yes, you may be more comfortable while you recover, but the timing of your recovery may take a little bit longer. So what I usually recommend instead is to use anti-inflammatory enzymes. The reason is that they actually help the tissue to remodel faster and more effectively. So I'll typically recommend using things like bromelain or serratia peptase. These enzymes should be taken away from food in order to have their anti-inflammatory effect, and they've been very well shown to actually help eliminate inflammation and speed the healing of damaged tissue. Also, you can use anti-inflammatory herbs. For these, I typically recommend curcumin, which is your typical turmeric. I also like a herb called devil's claw and another herb called Boswellia serrata. And the reason is that all three of these herbs have been well shown to manage inflammation while allowing the body to heal effectively. Some people may like to use something called white willow bark. I typically will avoid this in sports injuries specifically because white willow bark is where aspirin comes from, or salicylic acid. And again, that may have an ability to impair collagen reformation. So I'll typically avoid white willow bark, but I really do promote the curcumin, using your devil's claw, which is known as Harpagophytum procumbens, or using Boswellia serrata. So those three herbs, very effective anti-inflammatories that don't impair tissue healing in any way. Now, if you have a bony injury, let's say you fractured a bone, there are ways to speed up the healing. Your doctor may tell you it's going to take 6 to 12 weeks to recover. I've seen many of my patients who, when they go back to see their surgeon or go back to see their doctor actually thinks they're at a 12-week follow-up, even though they're only at a 6-week follow-up, because of all the additional work they do to allow that bone to heal. Now, if you have a fracture, very likely you're going to need it immobilized. This is often done through some sort of cast or air cast or brace. However, things like toes, we typically won't even cast because it doesn't make a difference in the recovery. But if you do have a fracture, immobilization is really key. It's very important. But what you also want to understand is that bone is a living tissue. And in order to get it to repair properly, it's going to need lots of minerals. So I usually recommend a multi-mineral supplement. And that's because bone is a lot more than just calcium. Yes, you need calcium. You also need magnesium. You need boron. You need silica. All of those minerals are very important at managing a fracture, as well as vitamin D and vitamin K2. Specifically K2. Vitamin K1 is more involved in clotting. Vitamin K2 is involved in the normal deposition of bone, and that's why it's so important. So ensuring adequate intake of vitamin D, adequate intake of vitamin K2 are very important at helping your body to heal from a fracture, and it can actually speed up your fracture recovery, get you out playing again a lot faster, and getting a lot more enjoyment out of the activities that you love. So I hope this video has helped you out. If you like it, please check out more of the videos on our channel, subscribe to the channel, and if you have any questions or comments, please post them below. And always remember, knowledge is health.